Hi, Dr. Page. I'm Steve with Lincare,
Hi, Steve.
your home respiratory services company.
All right, thank you.
And I'm here to benefit your Medicare patients and saving them money on the cost of their respiratory medications.
Okie dokie.
Well, doctor, first thing I'd like to find out is what factors come into play for you, what's important to you when deciding the regimen for one of your COPD patients, when you decide whether they need an MDI, a DPI, or nebulizer therapy.
What's important
What
when
helps you decide whether the patient should be started on an MDI, a DPI, or nebulizer?
Okay, so how do I decide?
Mm-hmm.
Okay. Well, activity level is one
Okay.
determining factor.
Do you mind if I take notes?
No, go ahead.
Okay.
How do I decide MDI or neb?
Mm-hmm.
Activity level is part of it, and another part would be dexterity.
Dexterity?
Mhm.
Okay. All right. And at what stage of the disease process do you find that it's important to use a nebulizer?
Earlier on.
Early on?
Mhm.
Okay. All right. And doctor, I noticed that 50% of your patients are Medicare, some 10% Medicaid. And with the current economic environment, the downspin in the economy, what types of complaints are you hearing from your patients about the cost of their respiratory medications?
Well, I do get patients who ask for samples.
Mm-hmm. So that would be samples of the MDIs?
Yes.
Okay. Samples of MDIs.
And then I keep hearing about the donut hole.
Right. That's been a problem for everybody in the last few years.
Mhm.
All right. And doctor, do you agree or do you believe that some of your patients are possibly are not being, excuse me, do you believe that some of your patients are not being compliant because of the cost? They're
Sure.
choosing to buy food over their medications?
Yeah.
Okay, so cost is a problem. All right, so doctor, what I understand is that you have a 95% population of COPD patients, obviously. The majority of them are Medicare, Medicaid, that you prescribe the regimen based upon their activity level.
Mm-hmm.
And dexterity is an issue. Obviously, older patients might have a problem with using the MDIs because some of those
Sure.
are pretty complicated.
Yeah.
And you tend to choose nebulizers early on, seeing the benefit of using a neb regimen. And some of your patients are coming in, using up your staff's time, probably coming in without a planned appointment, asking for samples.
Yeah. That's not a big deal if they come in, but the samples, yeah,
Mhm.
is a little tip off.
Mm-hmm. It is nicer to save the samples for patients that you're starting to work with to see
Yeah.
what sample works properly.
Mm-hmm.
All right, I agree with that. So, doctor, everything I've described about our respiratory, at Lincare, we own our own pharmacy called Reliant. And when you place your next Medicare respiratory order through Reliant, several things occur. The first thing is you fax it to the Reliant pharmacy, and we immediately get notified in our office about this. And if you would prefer, I could go down to the hospital right away for each of your respiratory patients, or meet with each of your patients and describe to them the process. What's going to happen first is we will ship out, we will deliver the medications to the patient's home every month. And that's a benefit to your elderly patients or the ones that are just housebound or the ones that can't afford gas or maybe they don't have a car. The second thing that is a great benefit to the patient is we bill Medicare directly for the 80%. That saves the patient from finding the money up front and paying for that and later getting reimbursed from Medicare.
Tell me about that.
Okay. Well, Lincare, we're a DME company, and therefore Medicare deems that if we're providing the equipment for the patient, that we also need to supply the respiratory medications. So we end up billing for the whole package under Medicare Part B and not Part D.
For the medications.
And the nebulizer.
Okay.
So you mentioned earlier that the donut hole is an issue. You have some concern about that, and patients spending more money towards the donut hole.
Mm-hmm.
But since we bill under Medicare Part B, they actually push towards the hole at a slower pace. Meaning if a patient's on 5 medications, and if I can remove 2 of those, the respiratory meds, they're going to move towards the hole slower because we're going to take their meds and bill them under Part B. And so some more benefits of our program are every month we have a clinician from our office. We'll call each patient that's on service with us. And if the patient does not need a refill, that means one of 2 things. Either they're getting healthier or they're not being compliant. That's for you to decide, not me. But what I'll do is I'll be the eyes and the ears in the home for you, and I'll give you the feedback of what's happening in the home. And what I failed to mention was we talked about the 80% being billed to Medicare. The remaining 20%, doctor, we directly bill the secondary insurance company.
Okay.
Or if the patient is a self-pay and they have no secondary insurance, we have a financial aid program. And when we set up each patient in their home, we show them this form and have the patient fill it out. And currently, 85% of the patients that are on service with us don't pay anything out of pocket. While the clinician's in their home, they also educate the patient on the proper usage of their nebulizer, how to maintain it, how to clean the filters, and of course, how to use the proper dosing of their medications. We're trying to alleviate some of the problems in the home so that it saves phone calls to your office. We also instruct the patient at that time if they have questions about their medications and or the equipment to call us and not you. So doctor, with everything I've explained about our respiratory services, respiratory medication services, do you agree that it would be a benefit for your patients that are currently on nebulized therapy as well as the patients you have on an MDI that are not being compliant because of the cost?
It sounds good.
Well, doctor, what's the name of a few patients that are currently the ones that are complaining, calling up to your office and complaining about the cost